Hi, I'm Dr. Daniel Meyerkort from Perth Orthopaedic and Sports Medicine, and today we're going to talk about recovery after knee replacement and what to expect long-term from your knee replacement. When you come into hospital, you'll be greeted by the anaesthetist, you'll be greeted by me. Most patients have the operation done under spinal anaesthetic, where your legs are numb, and this gives you the vast majority of your pain relief. It's then up to you. You can have a light general anaesthetic to go to sleep, or you can be done under sedation. The anaesthetist will work out what is best for you together with your wishes. I injected lots of local anaesthetic around your knee, which makes you quite comfortable. And the anaesthetist does a nerve block, which again can give you some additional comfort for the first few days. When I see patients on day one, most patients actually feel quite good. They often are moving their knees quite freely and they have little pain. Day two is where it gets most sore. If you expect it and know that this is going to happen, the nurses will keep you topped up with painkillers to keep you comfortable, and the physios will come and they will get you moving and get the knee bending. By day 3 to 4, most patients go home. Patients come and see me for their wound check at day 7 to 10. By this stage, most patients still have significant pain and swelling, but they're starting to reduce the amount of strong or opiate painkillers that they were taking in hospital. Most are still using a crutch. Most still have a little quads weakness or difficulty with straightening their knee, and that is very normal at this stage. By week 3 to 4, most patients are off their strong painkillers and are starting to wean their crutches. Most patients will still take crutches when they leave the home until week 6. At week 6, most patients are reasonable. They're not perfect. They still have some swelling, some pain, and they are still recovering, but they're starting to become more active and they're starting to slowly return their life to its normal activities and things that they like to do. So, some common problems that we encounter. So difficulty with sleep is very, very normal. This can last for weeks or sometimes even a few months after surgery. Obviously during the daytime there's many other things to distract you, but at night time there's no other distractions, and so painful knees or difficulty with sleep can be very normal. Swelling can certainly persist for a few months after surgery, and it can take 6 to 12 months until it gets to its best. Numbness or a numb patch is almost universal. So on the lateral or outer aspect of your knee, there's a small skin nerve that we always cut, and this results in a patch of numbness. It doesn't cause problems, but most patients forget that we've talked to them about it. Difficulty with kneeling is quite universal after knee replacement surgery. One of the surgeons in our practice is doing a whole PhD looking at reasons on why patients have difficulty kneeling. You can kneel, you will not do any damage, but due to the numbness and a little scar sensitivity, many patients are a little reluctant to kneel after knee replacement surgery. Clicking is very normal after knee replacement, and this is just the sound of metal on plastic. Some patients describe a little stiffness or a little wobbliness, but again, this tends to be low grade. By 3 to 4 months, most patients are good, but certainly it can be 6 to 12 months to get to your best.